Hi everyone. Today I'm just going to tell you in a nutshell exactly what CBIT is and why it was developed. So it was developed through the Tourette's Association about 20 years ago. A bunch of their doctors and researchers, psychologists, social workers came together and said, we have to kind of figure out something. There's no therapy, there's no medication specifically for tics or Tourette's. And what they were seeing is with some of the comorbidities like OCD and stuff, they were doing habit reversal, which was helping people. Like when people have OCD and they want to wash their hands a lot or do repetitive behaviors. So they said, let's come together and figure out if we can kind of use the structure of that therapy, but make it our own and help people that have a tic or Tourette's diagnosis. So that's what they did. They came up with comprehensive behavioral intervention for tics, which is CBIT for short. And basically what CBIT does is it is training the person to be more aware of their tics, training the person to do competing responses when they feel the urge to tic, and isolating factors in the person's life that can make the tics worse and modifying those behaviors. There are, I want to say, a decent amount of people trained to do this, but it's still sometimes scarce and hard to find someone. That's why I think a lot of people opt for virtual. But if you are interested in finding someone, you can always go to the Tourette's Association of America's website and look up CBIT providers, and you can put your zip code in and it will show you people in your area if you want to do face-to-face. I do virtual for most people, 95% of my clients, because they can't find someone in their area. And I think people enjoy having the virtual because they don't have to worry about running out to see someone or running late for school or appointments. So it's more leisurely. So I'm on the Tourette's Association, and mostly anyone that you want to find that is CBIT certified through the Tourette's Association. I don't know any other way people would get certified to do this therapy. So I would say go with someone that you find on there. I have talked to people in the past that have went to therapists that told them that they can help their child doing this type of therapy, and then a few appointments in realized that's not what they were doing. So it's a very, very specific therapy that has absolutely amazing results. Sometimes people don't want to do medication. Sometimes they can't handle the medication. But this therapy has, I want to say, about an 85% success rate, but you have to want to do it. So it can't just be the parents want the child to try it. The child has to really want to do it because they have to put in the work. And if they put in the work, they're definitely going to see the results. And I'm going to go more in depth what it's like to actually really do CBIT. And I'll do another video of start to finish, when I first meet someone to when I start working with them to what we do in each session, and I'll walk you guys through it. I'm also thinking of maybe in the next coming weeks to do like a live, so anyone can hop on and just ask me questions. I hope this was valuable to you, and I hope you guys have a great night, and I'll see you guys tomorrow.